Senator Baldwin.
Thank you, Mr. Chairman and Ranking Member Murray and our witnesses. I want to try to cover a lot of territory in my 5 minutes, so I'd certainly be appreciative of concise answers. But I want to start with Dr. Redfield. Dr. Redfield, do you think that the current testing protocols at the White House presents a model for other essential workplaces?
I'm sorry, Senator, you broke up at the beginning of your question. If you could just say it again, I'm sorry.
Yes. Dr. Redfield, do you think that the testing protocols currently in place in the White House present a model for other essential workplaces?
Well, I think, thank you for the question. I think one of the important things you bring up is the essential worker guidance that CDC put out. And I think it was originally modeled, obviously, on healthcare workers, where there were significant healthcare shortages in individuals that were exposed.
Many workplaces, I'm asking you if you think that the White House protocols for testing are a model for other essential workplaces.
I would just say that I think each workplace has to define their own approach to how to operationalize our.
We had some considerable comment on the fact that OSHA has not stood up an enforceable mandatory emergency temporary standard for workers in all sorts of work settings. But that aside, would you say that the PPE rules and protocols in effect right now in the White House are a model for other essential workplaces?
We would, my own view would go back to the guidelines that CDC has put out about essential workplaces for people. If they are an essential workforce, that they go in public, they maintain 6 feet distancing, and they wear face coverings.
Okay. Admiral Giroir, you have testified about how far you've come with regard to testing assessments. I want to ask you if you believe that we already have a national testing strategy today that spans from the nationwide testing needs assessment to the nationwide testing supply assessment, and a strategy to fill that gap, to procure domestically what we need in terms of bridging that gap with testing platforms, swabs, specimen collection media, and reagents, and the PPE needed to conduct those tests.
So thank you for that. We do have a strategy that spans us at least to the fall and beyond. As I mentioned, we're working individually with every state, and I think Senator Paul is correct that Kentucky, Wyoming, or New Jersey, Rhode Island are different, and there are vastly different testing needs. The East Coast will have multiples of testing versus other states, and we're working those individually.
So I know you testified earlier that not only are you working with the states, but you're working with every lab in every state to increase capacity. What about working with those who would be those who would need testing to, say, reopen their school, their university, their business? Each of them have identified what they think are their testing needs based on, guidance, not mandatory enforceable rules. But are you in contact at that level? Is your dashboard have visibility at that lowest level, or are you mostly in contact with the states and with the labs?
So over the last few months, we've done a lot of the individual work at nursing homes, at meatpacking plants, really down to the very granular level.
Okay.
Where we are right now, however, is we are really working with the state leadership, with the public health lab, the state epidemiologists, the shows, the state health officials, because they really need to understand what their sum is going to be in their state.
Okay.
And then in the funding, we're asking very specifically in the CDC funding for specific plans for schools, nursing homes, underserved, et cetera.
So I have two more points that I'm going to make. I don't have time for questions. One is about the transparency of that needs assessment. Can the public see it? Can the state see it? Can the HELP committee members see it? Is it publicly available? And secondly, the delivery of this supply is a critical issue. And it seems to me that the logistics for getting this out, whether it's PPE, testing, or medical equipment, is still extremely fragmented, leading to price gouging and many other inefficiencies. We need to stand up the full power of the Defense Production Act.
Would you like me to comment on that, ma'am? I'm sorry.
I'm happy to have you comment with the indulgence of the chairman. We've gone over time, and you can
why don't you
also
try to
get
give
back
us
to me.
a succinct answer to the senator, please, Admiral Giroir?
Yes, ma'am, and yes, sir. Particularly for things like swabs and media, there is still a very, I would say, non-mature industry within the country, and that's why we've made the decision to procure that all centrally through December, and then distribute that to the state, because there are just too many small companies, too many variables to control without a really heavy federal hand. That's just an example of where we really moved into that and used the DPA for swabs to help support American industry. In more mature aspects of the industry, like some of the large test producers, we feel that by helping direct them to make sure that the states get what they need in the right distribution, that we're not procuring them directly by us. But again, we're going to be very evidence and data driven as we move on. Thank you, sir.
Thank you very much, Senator Baldwin.